Friends, with the permission of the chair, I'll be talking this afternoon on dry eye and LASIK. I do not have any financial interest. Dry eye is a multifactorial disease of the tears and ocular surface that results in symptoms of discomfort, visual disturbances, and tear film instability with potential damage to the ocular surface. It is accompanied by increased osmolarity of the tear film and inflammation of the ocular surface. Dry eye is a multifactorial disease. Tears normally keep the eye moistened and lubricated. Stinging, burning, dryness and redness will result if enough tears are not produced to keep the eye moist. Dry pre-LASIK workup. Many people wanting laser vision correction or even patients with a long-term contact lens users now have the choice of actually solving their pre-existing dry eye problem if it is diagnosed in the LASIK consultation. Screening for LASIK has led us to an advances in dry eye detection and its treatment. It is common, the post-LASIK dry eye is common. It occurs in about half of all the LASIK patients. Condition usually is temporary and mild, may continue for a little longer duration in some few patients. Dry eye is a complex multifactorial disease. LASIK and other vision correction procedure can cause dry eyes by reducing corneal nerve sensitivity. Any factors that disrupts the relationship between the ocular surface and the lacrimal gland will lead to an inadequate tear production. Loss of congenital goblet cells also is one of the factors for the dry eye, and the dry eye can cause a discomfort and less than an optimal visual outcome. Quality and quantity of the tears is important and takes the preventive. You should always take a prevention and correction and preventive and corrective action prior to the surgery. There are various dry eye test detections like Schimmer's test, tear film breakup time, imaging, overall clinical eye examination. Who are the people who are at the most risk of the dry eye? Mostly, the risk of developing dry eye is correlated with the degree of the pre-operative myopia and the depth of the laser treatment. Higher degree of myopia who requires a deeper removal of corneal tissue to reshape the eye. So we should consult the patients about the dry eye if they are going through the LASIK treatment. Other causes of dry eyes are like old age, taking antihistaminics, anti-hypertensive agents, antipsychotic agents, topical medications, autoimmune diseases, and unusually dry climate. Prior treatment for a dry eye before the LASIK procedure is very important. We advise patient to take vitamin A, fish oil capsule, or flax seeds for few weeks or before or after the treatment. Friends, the flaxseed oil is very important for us, and it's like a nature's gift to us because it stimulates the tear secretions, improves the quality of the meibomian gland secretions, it thins the meibomian gland secretions. Other things to be used for the dry eye are the use of the preventive free lubricating, preservative free lubricating eye drops, use of corticosteroid drops as an anti-inflammatory. A cyclosporin is also very important and it helps to formulate the tears production. Cyclosporin has been formed to quicken the recovery of the corneal sensitivity after LASIK and thus returns the eyes to the normal moistures. That helps it to improve the quality of the vision. Sometimes we may have to go for a punctal plug. Preventing dry eye after LASIK, like a proper eye history is a must. Always avoid blowing of the air in the eye. Add moistures to the air or use of humidifiers. Consider wearing the protective glasses. Take an eye break during long computer uses. Position your computer screen below your eye level. Be aware of your environment and pollutions. My suggestion is increase the eye lubrication in advance of a LASIK procedure, even if you don't have any sign of dry eye. I recommend a use of lubricating eye drops or other therapies to help to maintain the eye moisture. Instead of LASIK, sometimes we may have to recommend a PRK procedure for an extra dry eye patients. The take-home message for us is that post-LASIK dry eye is common and can be significant in few patients. Patients should be examined carefully prior to the LASIK for any signs of ocular surface disease. Careful attention should be taken during the surgery to minimize the ocular surface damage. In patients with a symptomatic post-LASIK dry eye, it should be treated aggressively so as to improve the optimal visual outcome. Thank you.